Welcome to the Science Plus Love Equals Cure podcast, the STXBP1 10-minute monthly update. This is podcast number 20. I'm Charlene Rigby, president and co-founder of the STXBP1 Foundation, and I'm also mom to STXer Juno and her big brother Luca. All right, today's topics: visit to Amsterdam and Matthijs Verhage's labs, thoughts on the new U.S. administration and rare disease advocacy, and a quick update on the STARR study sites. Well, spring has sprung, or at least it's trying. I'm looking out my office window onto our backyard, and I'm in San Francisco, and we have lettuce coming up in the backyard and flowers, and we're having some really lovely warm days now. I did get to travel to a colder climate, which brings me to our first topic: visit to Amsterdam and Matthijs Verhage's lab. So the last week of February was Rare Disease Week, and I went to the Netherlands to speak at a bio neuroscience conference. Before the conference event, I was able to visit with Matthijs Verhage at the VU. And I know that I am not doing justice to his name, so forgive me for that. Dr. Verhage is one of the longest standing researchers on STXBP1. He did his postdoctoral work in Thomas Sudhoff's lab and worked on one of the first mouse models, or the first mouse model for STXBP1. His first papers were in the late 90s on STXBP1, and if you look him up in PubMed, you'll see that a lot of times STXBP1 is referred to as Monk 18 in those papers. These were basic research studies on the biological function of STXBP1, its role in communication between neurons. This place where neurons communicate is called the synapse. And as I said, Matthijs's first papers on STXBP1 were in the 90s, and this was almost 10 years before the first paper on patient cases was published in 2008. So I first visited Matthijs's lab in 2018, and this was a couple of years after Juno had been diagnosed. She was diagnosed in 2016, and we started the STXBP1 Foundation in 2017. And I still remember that visit so vividly because, frankly, it was the first time I had real hope that we would be able to help our kids. I remember he didn't have just one person working in his lab on STXBP1. He had many. And I got to see multiple lab experiment setups, including the patch clamp, where very precise experiments can be done on a single nerve cell. It was pretty awesome. And so at this visit, Matthijs's functional genomics department had moved to a new building, and this new building was really amazing and new, and it had a special concrete floor on one of the stories for these really highly sensitive experiments where any vibration can be a problem. The Functional Genomics Department is part of the Center for Neurogenomics and Cognitive Research at the VU Amsterdam, and their research focuses on the presynapse. The STXBP1 protein is involved in this presynapse, and as you remember, the synapse is where communication between neurons happens. STXBP1 helps to push neurotransmitter out of a neuron, and then this neurotransmitter goes to other neurons, and that's how the communication process works. So my visit was on the 24th of February, and it was really fantastic to sit down with Matthijs's group, and they gave some presentations. So some continuing work was presented by Lara Jansen and Amparo Roig-Adam. They both presented at the Research Roundtable in July of 2024. And I got to hear updates from other PhD students: Matthew Van Heusen, Sylvia Korhorn, and Romina Ambrosini Defendi. So there will be more updates on that work in Heidelberg. It was also great to see Ruud Tunen, Claudia Pearson, and Kelsey Axe from the FGA there. Ruud and Claudia also attended the bioneuroscience conference that I presented at the following day. And the panel that I was on, Patient-Driven Innovation, included three advocates from three different rare neurodevelopmental disorders. So Alison Berendt from the Foundation for Angelman Syndrome Therapies, Sunitha Malapati from the CACNA1A Foundation and the Buffalo Initiative, and me. And the theme of our panel was how patient advocates and patient advocacy groups are changing the landscape of therapy development for their disorders. This is really what we are doing with STXBP1. So one of the things that we were emphasizing was that it's really important that industry partners recognize what these patient advocates and patient advocacy groups are doing and that they partner with us to develop therapies. So it was a great few days in Amsterdam. All right, I'm going to move on to my second topic, thoughts on the new US administration and rare disease advocacy. This new administration in the US has brought a lot of change, and regardless of where you are on the political spectrum, concerns about rare disease priorities are really at the forefront for our community. At the end of February, it was Rare Disease Week, and the NIH and the FDA were holding a Rare Disease Day in DC. This ended up getting abruptly canceled a few days before the event. And as shared in one of our blog posts, this was really disappointing as, I think for the last 5, maybe even 10 years, this has been an important event for advocacy, networking, and learning about new research. Despite this, Christina Brennan on our STXBP1 board attended Rare Disease Week on Capitol Hill to represent the foundation and our community. In her Rare on the Hill report, which is also on our website, she highlighted 4 key legislative initiatives for the rare disease community for 2025. The first one is support steady and robust leadership, federal biomedical research funding, that's a mouthful, and public health agencies. The second is support the reauthorization of the Rare Pediatric Disease Priority Review Voucher Program. The third include the Accelerating Kids Access to Care Act. And number 4, join the Rare Disease Congressional Caucus. So you can and should read more about these on her blog post. I will just highlight the Rare Disease Priority Review Voucher for pediatrics. And what this is it provided significant incentives for pharmaceutical companies to invest in research to bring treatments for rare disease to the market. And it was first put in place in 2012, so over 10 years ago, for rare pediatric diseases. And the goal now is to reauthorize this program. I want to point out that this program does not cost the government any money. It actually just creates a market mechanism to incent companies to work on rare pediatric conditions. So please follow and reach out to Christina if you'd like to get involved in advocacy. All right, our third topic, Stanford and Cincinnati sites for the STARR Natural History Study. So we've gotten a lot of inquiries about what is happening with these sites. And so for the STARR study, the Stanford site has seen its first patients and is looking forward to seeing more in Q2. And on the Cincinnati site, there is good progress in terms of getting the site started. It's not quite ready to launch, but it will be soon. So please reach out to research@stxbp1disorders.org to get on the list for both sites. And just as an FYI, Juno and I will be at Colorado in early April for our STARR visit. So I'm looking forward to seeing other STXBP1 families. All right, let's call it a wrap for today and looking forward to connecting with you again next month.